Hello and welcome to the Midlife Makeover Show. We are super excited to be here today because we are going to be talking about a very hot topic, as you can see from the title. We are going to be giving our thoughts on Ozempic and other semaglutide drugs. We do want to say, we want a disclaimer, we are not doctors.
We're on the preventative side.
We're on the preventative side of things, yes. So these are our thoughts as nutrition professionals, as fitness professionals, as people who work with women day in, day out on their personal goals towards fitness and fat loss. Here are our thoughts. We're just going to tell it to you straight.
Yeah. And don't forget to drive us a live, hashtag replay. You know us. We are Narit and Sarah. Coach Narit and Sarah, creators of the Midlife Makeover program. We've been here for over 11 years, coaching over 1,000 women now to get in their best shape by doing 3 workouts a week from home and eating a real food that they love.
And we want to say this is a judgment-free zone, right? So we are coming with our honest thoughts and opinions. We are not judging anybody for their personal choices. You guys all know what I really believe, like, women know what is best for themselves, and you have the capability of making that decision for yourself.
No shame.
Yeah. So did you want to get started with the next part?
I just want to share, first of all, what they are. Do people know what, just to make sure we all know that their injections are once a week injections through your thigh, through your stomach, and through your arm, right? So, or by now, maybe other places in your body. So yeah, I wanted to start off with a little, like what she was saying with a disclaimer, is that with doctors, and everything I say is, of course, my opinion and in some facts. So my sister's a doctor. We know several doctors. We work with several doctors in our program, as well as nurses. So doctors are not required to take lots of nutrition courses. They only have to take one nutrition course. So we are on the preventative side, and we know a lot about nutrition. The doctors and nurses are on the other side of after. So I wanted to start with the disadvantages of being on these drugs. So starting with the research, starting with everything else, and why I personally wouldn't use the drugs for myself personally, and at this time in my life. And the reason I would say never, I wouldn't never use it, is because I never use the word never, because every time I use the word never, there I go nevering. So I wouldn't say never. I just say, like, it's highly unlikely. So first of all, there's genetic cancer linked to my family, and there's a correlation, causation to cancer. So it's just not worth to me the risk for it. The next thing is that there is some side effects of nausea, diarrhea, heart palpitation, vomiting, all those things. And to me, that's loss of pleasure in my daily activities.
Well, and you have a sensitive stomach anyway.
I was going to say that. Yeah, so good. Like, and I just like to feel good. One of the main reasons that I do what I do is because I've been on the other side, and now I am on this, I've been on this journey. I feel so good. And it's my best thing is to help women look their best, but also feel their best, feel energy, get out of joint pain, and all these things. And that happens when we feel good, right? So we want to feel good. And a lot of what these drugs do, and the research shows that you have to continue to getting these injections in order to keep the weight off. And so what these injections do is you lose, right? They suppress your appetite, right? So you do lose weight, but you also lose muscle, which is everything kind of, is very, very concerning to me, right? And should be to you. So
unless you're like doing something to prevent that muscle loss, and we'll talk about that a little bit later.
Absolutely, yes. So to me, the risks are too big for someone who is who is, really valuing my everyday quality and enjoying of life, at someone, who doesn't, even when I started, it wasn't like, 20 to 30 to 50 pounds to me is something not worth doing.
Yeah, I think what you're saying is like for you personally, the risks outweigh the potential benefits. But there's others out there where the benefits may outweigh the risks, right? So again, these are our personal thoughts and our opinions. I think for me, one of the disadvantages that worries me is just the lack of long-term research on it. Like we don't really know what's going to happen after 5 years of being on these drugs, 10 years of being on these drugs, et cetera, right? And we do know the research indicates that like when you stop taking the shots, that the weight comes back. So you are making a decision basically that you're going to be doing this for the rest of your life or for however long you want to maintain the effects of the shot, right? And I don't think that's necessarily a complete reason not to do it, because I'm thinking like for the person out there who is really significantly obese, right? And there's so many health complications that come along with that. So, your heart health, your blood pressure, your mobility, arthritis, joint health, all of these things that can be, impacted by obesity. Like if you're worried about having a heart attack in the next year or 5 years because of your weight and your health, well, then for you, then the benefit probably outweighs the risk, right? So that's a completely different situation, and it might be worth, not knowing what these long-term effects are in order to get that short-term gain of, not dying in the next 5 years. Yeah. So I can completely appreciate that.
Yeah, if you're like 100 pounds overweight and your family doesn't have like the history of pancreatic cancer, one thing that concerned me is it's very the pancreas. It affects how it affects the pancreas, and if you get diagnosed with any pancreatic cancer, it's not a good diagnosis, right? There's not a lot they can do, and that I think is what's really scary to me personally because of our family history. So because anyone getting anything associated with the pancreas, right, is it's not a good. It's not a good.
Oh, and also the cardiac stuff too. Like I have a cardiac thing. I have a heart defect. You've had heart stuff too, and so that would, like for us personally, would again be a hesitate, a pause. So I do want to talk about some of the advantages, right? Because I don't want us to come off like just wah, 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 don't do it. That's right. That's not 100%. What we're trying to come off as. There are some advantages, right? So, like I talked about before with the obesity, if you're worried about literally dying in the next few years, that is a huge advantage to kind of take that worry, off your plate, so to speak, or that weight off of your shoulders. It can also help with what we've heard is the term food noise. So if you are a person who really has a hard time controlling your food intake, like you're a big emotional eater or a compulsive eater or just always thinking about food, like once you stop a meal, you're always thinking, what am I going to eat next? What am I, or the ice cream's in the freezer and you just can't stop thinking about the ice cream until it's gone. What we've heard is that these shots really can help with that food noise and help, not with willpower exactly, but just being able to kind of shut that off and then meet your goals when it comes to nutrition a little bit more easily. It does help with appetite. So you feel more satiated. You don't eat as much. I think this is a pro and a con. I know I have a friend personally who is taking the shots, and just kind of watching her behaviors, like to me, it looks like almost like medication-induced anorexia, which sounds severe, but like it really, the appetite has been so low, she's not eating a lot, right? And so yeah, she's losing weight, but like Narit was talking before, are you losing fat or are you also losing muscle? If you're not combining this with an exercise strengthening plan, then you run into the risk of you're just losing your fat, losing your muscle, and that's not a metabolically healthy place to be. You want to have a good amount of lean muscle mass, right?
We just had a client share a couple of years back. She had done this and she had lost, 40 pounds and then she gained it all back. So now she's, worked with us for a year. She lost 44 pounds. Her A1C is down. So I just want to be very, very careful of how we do this. So I just want you, I would love to hear your opinions in the comments too about this. I got some research. So, cause I always pull up research. So the average 50-year-old woman attempts 65 diets in her lifetime. Oh 65 diets in her lifetime. So what my whole mission, our whole mission is to say yes to yourself, right? And change your life for the better. So when I say change your life, I always look at it up here first, right? And when I say our mindset is whether you think you can or you can't, you're right. So as you know, I was diagnosed with hypothyroidism. I went into early menopause. We've heard every single story, right? And you can absolutely do it. So whether you're taking the meds or not, we just really want to tell you that the quality of how you lose the weight matters, because our goal is to transform your life and keep it off. So we're gonna walk you through what you need to do. So how to naturally avoid the food noise, right? How to naturally do this, whether you're taking them or not, right? Because we don't want you just being on these meds and just eating like 500 calories a day. That's a formula for disaster. That's what our client did before when she lost the weight and then gained it all back, right? So whether or not, we want you to eat well, have a plan. So what does having a good plan look like? What is having a good plan?
Well, you know me, it's all about the formula.
Yeah.
Protein, carb, and produce at every meal. So every time you sit down to eat, are you building your meal around protein? Are you having healthy carbs, or have you decided carbs are the enemy and you're never eating carbs again? Because honestly, good luck with that. So protein, carb, and produce. So a veggie or a fruit. And you should have more often veggies than fruit for health, but fruits are not the enemy either. You can eat fruit, right? So yeah, whether you're taking the shots or not, you want to be building strong, healthy meals, right? You can lose weight eating French fries at every meal if you're just eating 100%. A little bit, if you're keeping your calories down, but you're not going to be very healthy eating French fries at every meal. And I love me some French fries.
Yeah. And you're not going to be like 93% of American women are not metabolically healthy. 93%.
And that is our goal with women in our program, and just in general with what we try to put out there, is we want women to be building metabolic health so that you are healthy throughout your lifespan. And so you're not frail as you hit old age, and you're not, that your metabolism is good and you're feeling really good.
Yeah. And that you are preventing diseases, right? Your heart is healthy. You are role modeling for your kids. You're eating real food. You are year-long consistently healthy. So to be metabolically healthy, right, you are eating right, not eating perfect, right? Eating right, and strength training, always building that muscle, because building that muscle, right, will naturally put your body right at, like, to burn fat, right? Which is why burning fat, right, by building muscle helps you lose weight, right? That's why naturally, but that's what sustains it.
And I think this is a piece that's missing from a lot of like these medical weight loss programs. And we've had people who we've had calls with where they've told us, oh, I'm not allowed to work out because they're taking the shots and they're being told to keep their calories so low that it doesn't support exercise. And when I hear that, like, honestly, it makes me so angry, because that's just not healthy, right? So whether you're taking the shots or not taking the shots, you should have strength training as a part of your regimen so that you are supporting your body's ability to function optimally and have good energy and be able to, lift things that you need to lift, like the groceries and the suitcases into the car and your grandchildren, right? That's what we want for people.
And I want to add that a lot of people speak to us and they are like, I have no energy. I can't strength train. I'm injured. I just had surgery, and there is a way to strength train through all those things. And I would love for you to send us a message and we can like walk you through and give you some ideas, because you can use your body, you can strength train without weights. There's so many things that you can do and not sit idly, right? I mean, there are so many things that your body can do, and it doesn't have to be an hour a day, 7 days a week. We work with our clients 20 minutes, 3 times a week. That's 20, 30 minutes, 3 times a week. That's like an hour a week of your time can make such a difference on your metabolic health, as well as you've seen the pictures, significant short and long-term weight loss naturally, right? So I just wanted to, before we get off, is just talk also about sleep and how important sleep is, stress, and most importantly, the quality of your relationships, who you're spending time with. I want you to think about what type of people you're spending time with. Are you spending time with people who value their health, right? Or, do they, drink a lot of alcohol? Do they go out to eat all the time? And what do they order, right? I'm not anti going out to eat at all. I love going out to eat. I love myself a glass of wine, but it's not like 7 glasses every weekend. I'm 44 years old. I just turned 44. My scholarship is up for one more day, and I'm too grown for that. I'm raising kids. I want them to be strong and healthy. This is a generational thing, right? So like when you do these and that's the only thing you do to lose weight, is that like we have an obesity epidemic. Like this is a concern. Like, is this the only thing to do? Like it can't be. It can't be the only thing. It can be part of the thing. We would love to hear how this resonates with you.
Yeah, I would love for this to start a conversation in the comments. Like, just be very honest. If you have questions, if you have opinions, we would love to just get a conversation going about this, because I know that I think a lot of people are interested in these shots. A lot of people are doing these shots. I think not a lot of people are talking about it. And so, we like to open up those conversations. Yeah. Let's talk about it.
Yeah. And again, absolutely no shame. There should never be any shame related to anything. Have a wonderful, wonderful Thursday, and we'll see you and talk to you very soon in our PMs.
Bye, everybody.